Hello all, hope you all are doing very well. In today's video, I am going to discuss about the absorption. It's a part of pharmacokinetics. In previous classes, I have already discussed about what is pharmacology, then what is pharmacokinetics and what is pharmacodynamics. Pharmacokinetics is a process like how your body will respond toward the administration of your drug. I mean, suppose if you are taking a medicine, right? So after administering that medicine, how your body will show response toward that drug. Like it will go, then what? It will go to the in our stomach. Then after that, it will break down. After that, it will go to the like small intestine. Then after that, from there to it will go to the systemic circulation. So we can say that it's the way like how my body will going to respond toward the medicine. Like whenever we consume the food, that time also the similar thing will happen. What there will be digestion. After that, what will happen? From the digestive like nutrient will be go inside the systemic circulation. This is the same thing, right? So in the case of the drug, what will happen? Now our body will follow the fourth thing. First will be the absorption. Then what will happen? Now distribution will occur. Then metabolism will occur. Then what will happen? Excretion will happen. So the absorption, we can say that it's a process like the drug will reach to the like systemic circulation from the site of action. Site of action means site of administration. Maybe you are taking a drug in the oral route and it's going, and after that it will reach to the small intestine. From small intestine, you can say that site of action, or the GIT means gastrointestinal tract. You can say that site of action from the site of like administration of a drug, and from there to it will go to the systemic circulation. This process we can say that it is the part of our absorption, right? To know the absorption, we need to know the all the flow chart here. Means we need to know all the things here, right? First thing is that the absorption depend on route of drug administration. Route of drug administration in the sense is that suppose if you are taking a dose like in the oral route in the sense you are taking a tablet. And another thing is that you are taking the thing like a drug in the parenteral, means in the like injection form. That time what will happen? If you are taking the injection, right, the response will come very sooner, very fast. But in the case of the oral route, what will happen? The drug will show response, but not as fast as in the injection form. So we can say that absorption also depend on route of drug administration. The second thing is that it is a lipid solubility. Lipid solubility in the sense is that the drug, like if the drug is lipid in nature, that time what it has the better penetration inside the cell. Why? Because the cell what made up of the cell membrane, mostly made up of that maximum constituencies are in the lipid form. So whenever the lipid is entering, that time it will be suitable for lipid to enter inside the cell. So we can say that if the drug is lipid soluble, so that time what absorption will be the faster. Now the concentration gradient. Concentration gradient means if you are taking a dose in a high concentration, that time what will happen? The absorption rate will be the higher. Now the blood flow at the absorption site. Our main objective is to reach from site of action to drug should reach in the systemic circulation. Now, if the flow is not appropriate, where in the small intestine, almost 90% absorption occur in the small intestine. If there is no blood flow, that time what will happen? Now there will be the drug will won't get inside the systemic circulation, right? So that time what will happen? Now the blood flow at the absorption site means it is required, it is essential. The blood flow should be enough, right? Now the surface area of the absorption site. Surface area in the sense is that the larger the surface area, the bigger the surface area, the rate of absorption will be the higher. If the small absorption area means the rate of absorption will be the lesser, right? Now in the case of the like how this drug like absorb inside the systemic circulation. From where? Like from our like small intestine. Small intestine also have so many different cells. From that cell, now you assume that after consuming drug, it is dissociated where in the like stomach, and after that is going towards where in a small intestine. From small intestine, how this drug, particular drug, will get inside the systemic circulation. It's mainly follow the like four methods. First is for the passive diffusion. Passive diffusion is nothing but what? The drug will get inside where in the systemic circulation by the passive diffusion. Passive diffusion is what? A process like the drug will go towards the low concentration area from the higher concentration area. The sense is that if you assume this is the small intestine, right? Now, after administering drug, the concentration of dose is higher where inside the small intestine. From small intestine, now we can say that by the help of one passive diffusion, so the drug will go where? Now inside the systemic circulation. If you consider this part, right? If this you consider as the small intestine, this one is the drug fragment at the higher concentration, and this part is at the systemic circulation, right? Now it will be by the passive diffusion, the drug can move from small intestine towards the where the systemic circulation. Now, what will happen? It may happen through the channel, through the membrane. Is the drug which are lipophilic, like they will easily move, and the drug which are not lipophilic in nature. So that time what? Now it will choose a specific channel, specific route, right? Now in the facilitated diffusion, what is occurring? The drug will get inside the where? Now inside the systemic circulation or inside the cell. How? By facilitated diffusion. Facilitated diffusion in the sense is that you can say that there will be like a drug that will be like accepted where in the transmembrane carrier. What is transmembrane carrier? If you consider this is the cell, right? So transmembrane carrier is nothing but what? It's a carrier, and it will means work as the what? The lock and key type. Means how? Suppose you consider this one is a drug. Now once it means involved in the transmembrane carrier, that time what will happen? This transmembrane carrier will help these drugs to get inside the cell. This is called as the what? Facilitated diffusion. Another part is about the active transport. Active transport is nothing but what? Now there will be the movement of drug, but what will happen? Here there will be the like utilization of energy, means utilization of ATP. Now here we have one features that drug, unlike passive diffusion, in the passive diffusion it was moving normally, means here no ATP was required. From higher concentration to lower concentration the drug are moving, right? But in the case of active transport, what is happening? If the concentration of dose is lesser, so that time also by the help of ATP it will reach to the where the into the systemic circulation or the area, right? That is active transport. In the endocytosis method, what is happening? Here there will be the engulfing of one drug, means from the outer side there will be the formation of vesicle, and after that that vesicle will come inside the cell and the endocytosis process will be happening. That is called as the engulfment of drug. Now what are the factors? What are the factors involved in the pharmacokinetics? Most important factor is that effect of pH, right? Effect of pH in the absorption. You need to remember that weak acids are better absorbed in the acidic environment, drugs like aspirin, while weak bases are better absorbed in the alkaline medium, which are what? The small intestine. Since the small intestine are the alkaline in nature and the stomach is the acidic in nature, right? Now we need to know about the bioavailability. So bioavailability is a condition like you can say like the amount of drug is present in the plasma after administering of a dose. Like if you are taking a medicine in the 100% of dose, right? Now 100% you are taking a medicine. Now by the inside the body there will be so many route. Like if you're choosing a GIT route, there will be the destruction of drug. But we need to know that in the case of bioavailability, we need to know after administering of a drug, like what is the current scenario in the plasma drug, right? After administration of a drug, it's not that like 100% we are taking the medicine, the 100% amount will be present in the plasma, but there will be like destruction, maybe 75%, 80% will be the plasma in the like drug present in the plasma. That will call as the what? The bioavailability. Then what is fast metabolism? We need to know that like there will be the destruction of drug before reaching to the systemic circulation. Like if you're taking a drug maybe in 100 mg, so there will be destruction where in the stomach, like in the stomach, HCl. After that there will be the like destruction of a drug in the epithelial tissue. So many different things are there, right? But in the case of the fast pass hepatic metabolism is that like before reaching to the systemic circulation, what is happening? The drug are involving in the like liver, and in liver there is so many different kind of enzyme, and due to this present of enzyme there is destruction of drug. So this also called as one fast pass hepatic metabolism, where the destruction of drug will occur in the like hepatic system, means in the liver, and this is called as what? The fast pass hepatic metabolism. Thank you.